Hello doctor, good morning. Actually
Hi.
today I just wanna ask about my symptoms of having frequent attacks, like 2-3 times of migraine and also blurry visions, not able to see the things properly. Even I tried paracetamol like 3 times or 4 times in a day, still not yet get rid of it. What can I do for that?
So this 2 to 3 attacks was in a span of how many days?
Actually monthly I will get 2-3 times and sometimes past 1 year I will get in this.
Past 1 year,
Yeah.
so monthly 2-3 attacks at least,
Yeah.
right? They say that paracetamol is not going away, it's getting again repeated attacks. So what you must understand is paracetamol is an acute symptomatic medicine. That is, if you have a pain right now, you take up paracetamol, you get relief. But it's not a preventive. So if you're getting frequent attacks, you should be on a preventive. I think Sir will tell us more about the preventers.
Yeah, see, the point is migraine is by and large not a serious condition, right? But then what happens, people tend to underestimate its importance, right? So we should have a balanced understanding. Firstly, it's not going to cause any long-term damage to the brain or lead to stroke, dementia, tumor, clot and all that, right? This is something people keep asking me. I hope I don't develop this or that. So the first point is it's not like that, but then migraine can cause serious disability in life in the sense that you may land up in the emergency room with severe headache, vomiting. You may have to take break from work, medicines may stop working, things like that, right? So what you're facing, I feel, what you're facing is that because of inadequate treatment, you've been relying only on one medicine, one strategy, and then you landed up in a situation where the migraine episode is not ending. What you need to do is you need to treat each episode, but when you need frequent treatments for that episode, you also need to take preventive treatment, right? So take more effective treatment. Paracetamol is effective only for the mildest attacks and initially, but as you go along in life, paracetamol may stop working. So you may find that you need a more effective treatment for the acute attack. Plus, if you are frequently using it, you need some preventive treatment. Frequency is a very important criterion. At least, if you're getting more than once a week, I think it's better to be on a preventive treatment. Otherwise, you'll end up like this in the hospital with injections and a lot of trouble. Okay? Does that answer your question?
Yes doctor, but what preventive medicine we can take?
Well, there are many options. We choose based on what is best suited for you. For example, if you're not sleeping well, then I generally choose topiramate. If you have any side effects related to it, people don't like, that slight sleepiness and that effect, I use beta blocker. Like that. There are many options. There are more new options actually. Right? So we'll discuss that in more detail in future.
Sir, is it true that beta blockers should be used with caution in young males? Anything related to sexual dysfunction or anything like that for beta blockers?
Well, I think it's a concern. People do have this, but it's more theoretical. I've not seen it much, right? I feel beta blockers tend to be, in terms of side effects, they tend to be much better. People, it has almost, none of the major issues. Whereas with some other medicines, sometimes people have issues of either weight gain or weight loss, or abnormal sensations in the hand, things like that, or sleepiness, which is a big concern.
So what about valproate? Do you regularly use valproate?
Well, I have been using it as a backup only, because when somebody is not, responding to the other medicines or had side effects, sometimes people have asthma, can't give the beta blocker. I tend to avoid valproate in women generally, especially those in the, the pregnancy years when they can potentially be pregnant, things like that. So, and valproate has far too many issues, right? Weight gain, fertility issues, facial hair growth, so many things to happen. Tremor, I've seen a lot of people with tremor following sodium valproate. So I tend to use it as a sort of last resort.
So basically, when somebody comes with migraine, the preventive treatment that you usually resort to is either beta blocker or topiramate.
Yeah.
So I have been hearing a lot about this new treatment, that is the injectable preventive therapy. Could you tell us more about it in the next video?
Yeah, we'll discuss more in detail about this.
Next.
Yeah. Okay.
60 days and no day.
Actually, ask about the symptoms of having frequent attacks, like 2-3 times of also issues.
Large one, sir?
Even I tried
It cannot be a large full screen.
Hmm.